A very good morning to our hematology lecturer, Sir Mahathir, our panel of experts, and to our fellow participants. First, I would like to introduce all of our panelists. To my left, we have Dr. Eshika, who works under the Ministry of Health in Malaysia, and on my right, we have Dr. Siva, who is also a professor of pathology, and I myself, Partiban, and I will be moderating the forum discussion for today. First, let me start off with the case study of a patient with multiple myeloma. A 55-year-old male presents with exertional fatigue and progressive back pain. He is otherwise well with no significant past medical history. His hemoglobin is found to be low at 10.6 with an MCV of 92. He has a normal serum ferritin, vitamin B12, and folic acid levels. Absolute neutrophil count is a 1.3 and platelets is a 117. He has a creatinine level of 0.9 and calcium of 99.2, sorry, and albumin level of 3.8. A serum protein electrophoresis is performed that demonstrate a monoclonal IgA protein of 1.5. A skeletal survey shows oculolitic lesions in the skull and bilateral humerus, and a bone marrow biopsy shows 30% involvement by abnormal appearing plasma cells confirmed by CD138 immunohistochemical stain. And now to begin with the discussion, now I'll direct my inquiry to Dr. Eshika about what is multiple myeloma, its etiologies, and how it affects the human body. It's on to you, Dr. Eshika.
Thank you, Moderator, for having me today. I'm Dr. Eshika, and I'll be discussing more about multiple myeloma. So what is multiple myeloma? Multiple myeloma is a cancer that forms in a type of white blood cell known as plasma cell. As you know, healthy plasma cells can help you fight infections by making antibodies that recognize and attack germs. In multiple myeloma, cancerous plasma cells accumulate in bone marrow and crowd out healthy blood cells. Rather than producing helpful antibodies, the cancer cells produce abnormal proteins that can cause complication. There are several names for the abnormal proteins, including monoclonal immunoglobulin or monoclonal proteins known as M protein. Next, what are the etiologies of multiple myeloma? So the causes for multiple myeloma are still not clear, but doctor knows that myeloma begins with one abnormal plasma cells in your bone marrow. The abnormal cells multiplies rapidly because cancer cells don't mature and then die as normal cells do. They accumulate and eventually overwhelming the production of healthy cells. In the bone marrow, myeloma cells crowd out healthy blood cells, leading to fatigue and inability to fight infections. The myeloma cells continue trying to produce antibodies, as healthy plasma cells do, but the myeloma cells produce abnormal antibodies that the body can use. Instead, the abnormal antibodies, which is monoclonal proteins or M proteins, builds up in the body and cause problems such as damage to the kidneys, and it can even cause damage to the bones that increases the risk of broken bones. However, multiple myeloma almost always starts out as relatively benign condition called monoclonal gammopathy of undetermined significance, which also in short known as MGUS. MGUS, like multiple myeloma, is marked by the presence of M proteins in your blood. In addition, it may be associated with a number of cell factors, for example, interleukin 6, which is a growth factor of multiple myeloma. And now let's move on to the pathogenesis of multiple myeloma, which is the development of the cancer. I'll be showing you a few pictures or diagrams regarding the pathogenesis. So let's start. For the pathogenesis, multiple myeloma is a malignancy of plasma B cells caused by alteration to genetic materials following B cells activation. Myeloma plasma B cells also express CXCR4 receptors for CDF1 alpha, a chemokine that regulates homing to the bone marrow where bone disease develops. Next, B cells are primed by B cells receptor recognition of antigens represented by follicular dendritic cells in the secondary lymphoid organ. CD4 plus helper T cell interaction activates B cells to differentiate into plasma cells and also induce isotype switching and affinity maturation. During this process, abnormal DNA recombination events translocate antibody genes to either chromosomes and generate a malignant phenotype. The myeloma plasma B cells continue to produce immunoglobulins, resulting in a gammopathy and ultimately home to the bone marrow. Next, bone destruction is mediated by the bone resorption of multiculated osteoclasts. Rankel also read as RANKL, is a required activation signal for osteoclasts. RANKL is secreted along with other growth factors by myeloma plasma B cells. Activated osteoclasts will then secrete interleukin-6 that promotes the survival of myeloma plasma B cells. And then next, to improve oxygens and nutrient supply to the myeloma plasma B cells, the formation of new blood vessels is promoted by soluble factors secreted by both the bone marrow stromal cells and myeloma plasma B cells. In addition, blood vessels and endothelial cells also secreted growth factors that promotes the survival of myeloma plasma B cells. And that's all for me for now. Thank you.
Thank you, Dr. Eshika, for giving us an insight on multiple myeloma and how it occurs. To summarize what Dr. Eshika have explained, I can say that multiple myeloma is an idiopathic neoplastic disease of the plasma cell where there will be an overproduction of monoclonal antibodies which act as an autoimmune response toward the bone cells. To have more in-depth understanding, I would like to pass this discussion to Dr. Sivarani to elaborate more on the lab diagnosis of multiple myeloma. On to you, Dr. Sivarani.
Thank you, Partiban. So first and foremost, I would like to thank the organizer for inviting me here to deliver some beneficial information for our forum today. So I would like to share more about this disease called the multiple myeloma. So firstly, I would like to talk about the principle, the lab test. So the goal of testing for multiple myeloma are to diagnose the condition, determine its severity and also the spread, and also monitor its progress, detect the complications as they arise, and also monitor the effectiveness of this treatment. So the lab test that should be taken is the multiple myeloma may first be detected during the routine wellness testing. So it may be suspected when a person has elevated total protein, elevated calcium, low white or red blood count, moderate to large amounts of protein in the urine. Next, I'll be continuing by explaining about the procedure. So first of all, you can also sit or lie down to have the test. And secondly, a person specialized in taking the blood chooses the best vein to use. Thirdly, they put a tight band around your arm above the area where they actually take the sample, and then they clean your skin, and then they put a small needle into your vein. So next, they attach a small bottle or a syringe to the needle to draw out some blood. So they might fill several small bottles to take the samples. And next, once they have already have the samples, they release the band around your arm. They then take the needles and out and also put pressure on the area with a cotton wool. So this would avoid bleeding. And you can also, it'll be advised for you to look away when they're taking your blood. So we can proceed by talking about the specimen and also the reagent. So firstly, the specimen, the diagnostic criteria for multiple myeloma are based on the results of diagnostic tests done on specimens of blood, urine, bone, and also bone marrow. So the reagent would be referred to the Banks-Jones protein urine test. Is used most often to diagnose and check on the multiple myeloma, this type of cancer. And we can continue by talking about the quality control. So quality control refers to the management of the symptoms. So it's known as the CRAB criteria used in the diagnostic of multiple myeloma. So firstly, C, which represents the hypercalcemia, R, the renal insufficiency, A, anemia, and also B, bone disease. So first, for the first symptoms, we can manage it by the hydration and IV biphosphonates. Secondly, for the renal insufficiency, we can correct the hypercalcemia and also possible dehydrations. For anemia, we can correct the iron, folate, and also the vitamin B deficiency. For bone disease, we can monitor required use of biphosphonates in the prevention of skeletal-related events. So that's all from me from the lab diagnosis. Thank you.
Thank you, Dr. Sivarani, for giving us a detailed explanation of the lab diagnosis of multiple myeloma. As what Dr. Sivarani has said, we have to first analyze the history of the patients and then go through with the physical examinations, followed by the complete blood count so we can narrow down our diagnosis. But to further solidify our diagnosis, we have to do the advanced investigations such as the advanced blood test where there is the electrophoresis, the urine analysis, bone marrow aspiration or biopsy, and other bone imaging tests. In order to have a further understanding on what are the signs and symptoms of multiple myeloma, we like to call upon Dr. Sivarani again to tell us about the characteristics of multiple myeloma. It's on to you, Dr. Sivarani.
Thank you to the moderators. So next, I'll be explaining about the signs and symptoms of this disease. So the signs and symptoms of multiple myeloma can actually be different And at the early stage of this disease, there may be also no symptoms. So when the signs and symptoms do occur, they can also include bone pain, especially in your chest or your spine, nausea, constipation, loss of appetite, and also mental fogginess or also confusion and also fatigue. So we should make an appointment with your doctor if you have persistent signs and symptoms that may be worrying you. So that those are the signs and symptoms for multiple myeloma. Thank you.
Thank you again, Dr. Sivarani, for enlightening us about the characteristics of this disease. As what Dr. Sivarani has said, multiple myeloma have its own unique set of signs and symptoms, which is bone pain, fatigue, constipation, mental fogginess, and so on. Lastly, I would like to graciously invite Dr. Eshika once again to give us the incidence behind multiple myeloma and any other additional info regarding this topic. It's on to you, Dr. Eshika.
Thank you again, moderator. So I'll talk about the incidence of multiple myeloma. Every year, there are about 2 out of 10,000 people diagnosed with multiple myeloma, which is believed to be the second common malignant tumors arising from blood. It is more commonly seen in the elderly that age around 50 to 65 years old, but age of onset trends to be younger in the recent years. Men have higher incidence of multiple myeloma than women, and the ratio is 1.6 to 1. With age increasing, the incidence of multiple myeloma can also rise, which has brought more and more harm to people's life and lowered their quality of life. And therefore, multiple myeloma has become a malignant hematological tumor that people cannot neglect. And besides that, the occurrence of multiple myeloma has certain relation to race, which indicates that the incidence for Black people is slightly higher. Okay, and let's move on for the treatment methods. There are a few such as stem cells transplantation, combination of Chinese and Western medicine, chemotherapy, and also radiotherapy. For the stem cells transplantation, it is recommended for patients less than 70-year-old, and if the conditions are allowed, the transplantation can be undergone. For the combination of Chinese and Western medicine, it is the first choice of multiple myeloma treatment. During chemotherapy, traditional Chinese medicine can be adopted to enhance the effectiveness of the chemotherapy, which also decrease the toxic side effect of chemotherapy, recover hematopoietic function of bone marrow, and also improve the immune function. During this period, the role of traditional Chinese medicine is to continuously attack myeloma cells, destroy residual myeloma cells so as to avoid their regenerations. Meanwhile, for chemotherapy, is a conventional therapy for multiple myeloma, and radiotherapy is less used, while patients with localized myeloma, localized bone pain, and symptoms of spinal cord compression are applicable to this radiotherapy. And that's all from me. Thank you.
Thank you, Dr. Eshika, for the detailed information regarding the incidence and treatments of multiple myeloma. Dr. Eshika had said that men have higher incidence of multiple myeloma than women, while increasing age can also bring rise to multiple myeloma. She also explained the treatment methods of this cancer include stem cell transplantation, combination of Chinese and Western medicine, chemotherapy, and radiotherapy. As we are nearing to the end of the discussion, I would like to conclude our forum today. Multiple myeloma is a neoplastic disease of the blood where an autoimmune response causes the blood to lysis and cause several other complications. Multiple myeloma is diagnosed after a series of tests such as blood tests, urine analysis, bone marrow tests, and bone imaging. Treatment methods of multiple myeloma include cell transplantation, combination of Chinese and Western medicine, radiotherapy, and chemotherapy. And now we will enter the Q&A session of this discussion. We have some questions from the audience towards the panelists. First question is, what are the possible preventions of this disease, which is directed to Dr. Sivarani? And the second question is, can you give some explanation regarding the risk factors of myeloma, which is directed to Dr. Eshika? Panelists, please proceed.
A good question. Thank you, moderator. There is no known way to prevent multiple myeloma from developing in those people with monoclonal gammopathy of undetermined significance of solitary plasmacytomas. So research is investigating if treating certain high-risk smoldering multiple myeloma may keep it from becoming active multiple myeloma. So food-related connection also to multiple myeloma might involve the amount of food you eat in general. So several studies have reported a higher risk of multiple myeloma in overweight and obese people. However, researchers have found some evidence that certain types of food might make you more or less likely to develop multiple myeloma, and general anti-cancer diets may help protect you from the disease. So that's all from me. Thank you.
Thank you for the question. So before we jump in, it's important to know that having risk factors for multiple myeloma doesn't mean that you'll develop it in the future. It's possible to have one or more risk factors and never get multiple myeloma. By the same token, an individual can have no risk factors and still develop multiple myeloma. So some of the risk factors were actually mentioned in the incidence part just now. There are a few factors including age, sex, other plasma cells conditions, and also genetics. From the age aspect, the risk of multiple myeloma increases with age. At the time of diagnosis, most people with multiple myeloma are age 65 or older. This is believed to be due to the accumulation of cancer-promoting genetic changes over an individual's lifetime. Then multiple myeloma happens at a slightly higher rate in males compared to females. It is estimated it occurs at a ratio of 3 females to 2 females. The exact reason for this disparity isn't known yet, and research from 2011 found differences in specific genetic events between males and females with multiple myeloma. The researchers theorized that these differences could influence further genetic changes that contribute to multiple myeloma. And then next, for the other plasma cell conditions aspect, having other plasma cells conditions such as MGUS can raise a person's risk of getting multiple myeloma. Let's look at this now. MGUS often has no signs or symptoms, and levels of M protein typically remain stable in many people. Because of this, it is impossible for a person to be unaware that they have MGUS. However, in some people with MGUS, the condition can progress into multiple myeloma. This occurs at rate about 1% per year. It's believed that almost all instances of multiple myeloma are due to MGUS progression. And then next, genetics. Family history has been found to be associated with increased multiple myeloma risk. So if a close family member, such as a parent or sibling, has been diagnosed with multiple myeloma, you may be more likely to develop it as well. This is because some genetic changes that increase the risk may be passed down from parent to child. A total of 23 genetic regions which are associated with MGUS have been identified as related to multiple myeloma risk. However, it's important to note that you can have no family history of multiple myeloma and still develop it. And hopefully that answered the questions. Thank you.
Okay, thank you to our panelists for answering all those questions from our audience. And I'm showing you a few references that we use for this discussion. And that is it for this time, guys. I'd like to thank our hematology lecturer and our fellow panelists who have attended and give us their precious informations about multiple myeloma. And I hope to meet you guys soon in another discussion. Thank you for your attention, guys. Thank you.